Hi, I'm Joyce Gerber with Health is an Inside Job. And I've been in private practice for the last 41 years as a holistic clinician and practitioner using functional medicine and naturopathy. I work with regenerative nutrition, detoxification, colon hydrotherapy. And for the last 3 years, as the lockdown was happening, I was fortunate enough to be introduced to an incredible technology called red light therapy, also known as photobiomudulation. And I have the honor and pleasure to present a very special guest today. His name is Dr. Carl Rothschild, and he introduced me to this technology. He has been working with it for a long time. He's created the top of the line technology for red light therapy, and he'll be sharing his brilliance and his expertise and information and answering questions I will be asking him. So without further ado, Dr. Carl Rothschild, please come on the screen. Hi, Dr. Rothschild. It's a real pleasure being able to connect with you today, and I'm so eager to share what you know with your audience, because I think people really need to know about red light therapy.
I started as a chiropractor 44 years ago. So you and I have that in common, over 40 years of practice. And 20 something years ago, I was introduced to red light therapy, like my red light shirt, by the way. At any rate, and it changed my career, it changed my life. But that was with equipment that was, like what we call dinosaurs now. I mean, it was great for the time. It was the state of the art, but the equipment we now have is many thousands of times more powerful and more effective. And as you said, with the COVID, by accident, or let's say we were forced into having to create a bed. Up until that point, we had other equipment where the practitioner and the provider were physically in contact with each other. And that became a problem during COVID. And so we created the bed where someone can get in and out of the bed themselves. And all we thought it would be was a substitute for what we had before. And what we didn't realize, and we did realize within a month, that we had something way beyond our expectations, where people were calling us up and saying, you didn't tell me it helps with this thing and that thing. So that was Parkinson's or dementia or heart attacks or stroke, Alzheimer's, diabetes. It was incredible. And of course, that was our first bed that we had made. And we have subsequently made newer and newer models as the technology keeps expanding. Because the technology is expanding, because the interest level out there has grown so significantly. I'm telling you that a person's life expectancy, and maybe more importantly, is their quality of life, will improve dramatically if they get in the bed regularly. And in fact, I have a little mug that one of my staff members made for me. It says, get in the bed, because that's my attitude. Someone says, well, are there any side effects? No, there's absolutely, in the 50 years that this technology has been researched and studied, never been a side effect. And basically, it doesn't affect metal or electrical implants. So we have a guy that had a defibrillator implanted into his chest because he was having a heart attack once a month. And then eventually, more recently, once a week, and sometimes even twice a week. And he would die, but he had this defibrillator that would shock him back to life. So his circulation was gone. His health was deteriorating and that was after 12 years of that. He gets in our bed, one treatment, 5-minute treatment, it changed his life. And you got to watch that video. We have all these videos, all the testimonials, all the information. And it's been unbelievably exciting these last 3 years. Now, I've been doing it for 25 years, give or take, in light therapy, but these last 3 years have been unbelievable, glorious. So with that said, I welcome any of you to learn more. I have this book that I wrote because people didn't know as much about light therapy as they thought they did. And I've been studying this stuff for decades, and I just knew I had to come out with a book which would make sure people realize what is the truth. This is the definitive response to what is red light therapy about. And you know, Joyce, you know what it's about?
Well, I'm sure you can expound on it, so please do.
It's about the sun. That's what it's about. What they found out that many years ago is that there are elements of the sun. And what we do is we take 4 elements of the sun, we concentrate them and magnify them many times and drive it into the body. We're not talking about putting anything in the body that doesn't belong there. We're not talking about yanking anything out or injuring or damaging any tissue. It's absolutely non-invasive. It's absolutely safe as can be. If you walk into the room and turn on the lights, our bed is that dangerous. In other words, it's not. There's never been a recorded side effect. As I said, it's about sunlight. And what they found was that the sun and elements of the sun actually stimulate the critical tissue of the body. And that tissue is called, or they actually call them an organelle. Not an organ, an organelle, which is the mitochondria of the tissue. So every tissue in your body is made up of cells, and every cell has mitochondria in it. And what they found was that the sunlight actually stimulates the mitochondria to do what they're supposed to be doing. So when you have someone that has a chronic condition, it's very likely that they have what they call mitochondrial dysfunction. So the mitochondria is not doing their job. And what the light does is it actually stimulates the mitochondria to do what it's supposed to do. We call it bringing it back to normal. So when I tell somebody that it will increase their testosterone, for example, I did a lecture on this, and the one guy said, well, could it be excessive amount? I said, no, it brings the body back to normal, not excessive amount, normal amount. And this study and this stuff has been unbelievable, knowing that we can stimulate the mitochondria to produce this critical molecule called ATP. And the ATP and the mitochondria is the reason why we eat, and it's the reason why we breathe oxygen. That's what it's all about. And what it does is produces ATP, which is the energy molecule of your body. And with the proper amount of ATP, you're alive. You're thriving, as a matter of fact. And with an inefficient amount of ATP, you have disease, and eventually you could die from that. And that's what the bed's about. That's what the light technology is about. And that's what I go over in detail in my book.
You know, that's what I've loved so much about working with this. You know, all these years, my whole goal is to give people alternatives to drugs and surgery. And I know it's been the same for you. And I got comfortable. My first license was in massage therapy, and I had miracles with that. Then I was using colon hydrotherapy, and using water internally to cleanse and heal made sense to me because that's natural too. Well, when the offices were all locked down a few years ago and I could not go and be close with people one-on-one and provide that service, there's Dr. Rothschild telling me about how infusing the body with light can totally rejuvenate and renew it. I wanted for you to share with the audience, tell us why you named it Trifecta.
Well, Trifecta is a model. So in other words, our parent company is not Trifecta, but the reason why we called it the Trifecta is before we named it Trifecta, when we had a previous model, we would be talking about winning the, trifecta, winning the trifecta is when you go to horse racing and they win the big trifecta. It means that they've won this huge thing where they bet $1 and they make $1,000 or something like that. So we were talking about the trifecta, but it had to do with the triple effect of face and skin and anti-aging. That's one category. Fat was the other, where it actually helps to reduce fat in the person's body. And of course, the healing. And the healing is what I most focus on because it has to do with, as a chiropractor, what I wanted to do always is heal people. And I want to tell you something, Joyce. One of the most rewarding things is when a patient looks you in the eye and they say, thank you for giving me my life back. And I had that, well, as a chiropractor. But now with light therapy, we're hearing that regularly. As I had mentioned before, Parkinson's, dementia, Alzheimer's. We have a lady that had a stroke, and after 8 visits, there's no sign of her ever having had a stroke. We have a lady that lost 100 inches from using the light therapy. She didn't change her diet, didn't do anything. 100 inches. Now she was big, of course, but when you cumulatively measure her main things, which is the thigh, buttocks, and abdomen, she lost 100 inches. And that's the amazing thing here. We're talking about the entire fitness industry. We have a whole division of our company called Performance and Recovery. And that's your athletes. If they get in our bed before their activity, before their basketball game or anything like that, they're going to respond much better. They're actually going to jump higher. They're going to be having more stamina. And then if they get in the bed after their activity, they will recover from their activity much better. And that's the beauty of the performance and recovery aspect of the bed. So we have the three divisions you asked: face, fat, and healing. And then there's men's health, women's health. By the second or third month, the average woman is going to tell you that they no longer experience the painful periods that they were experiencing up to that. We're seeing cysts on the ovaries shrink. So face, fat, healing, men's health, women's health, mental health, senior citizens. We target senior citizens because I am telling you that the more severe the person's problem is, the more dramatic the results are. So if someone gets in the bed and they're really fine, they don't have any issue, I don't know if they're going to notice a big difference after they get out of the bed. But somebody that's really a mess, where it has the Parkinson's, dementia. We have people who have Parkinson's where there was one lady, she was talking about being at church and she couldn't read her Bible because her hands would shake so much. And after 2 weeks, her hand still had a slight tremor, but it was hardly noticeable. And she could read. I mean, that was her disability, so to speak. Now she could go to church. Not only did she feel better in all the other ways, but that was the most important thing that she came up with that was critical for her. And so at any rate, face, fat, healing, mental health. So there are actually 9 divisions, but the reason why we called it the trifecta originally was face, fat, and healing.
So please, again, name the other 6. What's the other 6 divisions if there are 9?
Okay, let's see.
Recall.
Men's health, women's health, mental health, senior citizens, performance and recovery, and cellulite. Did it.
All right. Wow. And I have to say, the gentleman you talked about before who was having the heart attacks, I live in Los Angeles, so I see clients locally at a couple of different health centers. And he was at one of the health centers where I saw clients. And it's so exciting. It's so exciting. I mean, I'm in contact with Dr. Rothschild often. And every time I'm on the phone with him, there's some doctor, some practitioner, some health center that has shared the latest testimonial with him. So it's so exciting to be involved in this. Please just share more of what you've been experiencing.
I don't know if I told you. So we have a nurse practitioner in Van Nuys out here in California. And I was talking to him. His name is Brian. And he has a patient that was so depressed. And I mean, it was just ruining her life. And you have to watch the video. I don't think I can relay as well as he does of what her reaction was. But in essence, it was about the fact that after 2 weeks of using the bed, that her depression, her suicidal tendencies stopped. And she would say something to the effect of, if this is how I should have always been, just think about what I've missed out on, how much better she is. So even mental health. Look, when the person gets in the bed, we also tell them to keep their eyes closed. And because I'm telling you, if the light can penetrate through the skull, it can certainly penetrate through the eyelid. And not to wear the goggles. That comes with the bed. I don't want them wearing the goggles because I want that light to penetrate everywhere. I want them to keep their mouths open also for the gum disease and tongue and throat and tonsils and all that. But getting back to the eye, anything in the eye, we've seen very nice results with the retina, so macular degeneration and macular edema. Cataracts, we've seen nice results with that. We've seen good results with people describing having floaters, and within a couple of weeks, they usually disappear. So I just love getting that energy into every square inch of the body. But getting back to this lady that was so depressed, I mean, I can't wait to I don't know if she'll come online because I think she might be a little embarrassed. But at least we got, and I want you later to show where these people can actually watch these videos. If they go to our YouTube channel, they'll be able to see all these different videos that we have on there. And when we talked to Arnett, that was a gentleman who was having the regular heart attack. I didn't know that he was going to be telling me about this. I kind of like it that way. It was very spontaneous. I think I should have been in improv when I was younger, but when I was talking, I kept telling myself, just shut up and don't say anything. I didn't want to interrupt him. The kind of things that he was saying, I hadn't heard before. But remember, before also, here he has an implanted defibrillator. And the reason why I brought this up partly was because to remind you that it doesn't matter that they have electrical implants or a pacemaker, for example, or they have any metal implants. They just had a shoulder replacement, a hip or knee replacement, because the lights don't affect them in a bad way. In fact, it'll heal the heck out of those areas. So, like I said, just get in the bed. Even Arnett, if you watch that, he'll say, just get in the bed. And, this goes to Jerisha, who had that stroke. She said the same thing. Just try it. Get in the bed. It's 6 visits. That's all it takes to really see a difference. If you don't see a difference at 6 visits, it's not going to work for you. That's never happened. But that's the max. By the 6th visit, if they're not seeing a difference, maybe they're too far gone, or for whatever reason, it's just not going to work out for them. So at any rate, I just wanted to mention one other lady. Her name is Janet. And Janet had stage 4 kidney failure. So she was this far away from having to be on dialysis. And now she's normal. Within a relatively short period of time, she went from a very low, they call it a filtration rate. Her filtration for her kidney was very bad, in the 20s. And now hers is nearly 70. So she's normal. That same lady, Janet, also had the macular edema. That means that her retina was swelling. And the treatment for that was a shot in the eye. Now, you spoke to Janet. Once a month.
Yes, it was incredible. Yeah.
Once a month she had to get an injection. Now, it's going to take longer, but I would say within 6 months to a year, don't tell her ophthalmologist that, but I don't believe she's going to need any more injections. It's already much improved. I think you told me that she went 12 weeks instead of normally a month before she needed. Did she get another injection? Is that what you told me?
She said it's much more spaced apart. I think it was weekly, and it might be as much as every 16 weeks or something like that.
Right. But I think eventually that it will improve that. I hadn't spoken to anybody with macular edema before. We've talked to people with macular degeneration, and with that, they start losing their eyesight, and now they don't. So we're seeing improved eyesight. We're talking about, from the aesthetic point of view, we got the weight loss, the skin, hair restoration. We have women talking about at the end of a shower, they'll notice hair in the bottom of the drain. And within 2 weeks, that stops. And within a month or so, it starts regrowing, and they actually have a thickening of their hair. So I'm being hard pressed to figure out an area of the body that we haven't seen remarkable results. Remember, as a chiropractor, I was using it on muscles, tendon. We had a guy that came in with a ripped Achilles tendon, and he was slated for surgery in a week. And when he went for the surgical review, he didn't need that surgery anymore. So, yeah, I'm loving this stuff. I love it.
And also, I would love you to share the other incredible result for Arnett that nobody was expecting, that his wife was so happy about.
So, yes. And he tells
it's
it.
Important. It's important.
We can do it because he was, it increases circulation so much. So here's what happened. So that first treatment was just 5 minutes. I told the provider, I said, I don't know, he might have a heart attack in your place. Maybe we should be careful. Just treat him for 5 minutes and stay in the room the whole time. That night he goes home, changed his life. They call me, both his provider, Lewis, and him. They're on the phone the next day. And he said, on top of everything, that I feel fantastic. My energy is just in that 1 5-minute treatment. But I also had the first erection that I'd had in over a decade. And it just keeps getting better and better. I don't mean just the erection, but all his health. talks about his energy. He talks about always wanting to go out and take walks, and he would walk slower than the elderly women on their, with their walkers. He would just be a mess. And now he's quickly walking around and having so much energy. It changes lives. And if you get a chance, I want to show everybody where they can find these, where the videos are. Hey, everybody. Now we're talking about the website. It's called trifectalightehealth.com. If you get a chance to go here, there's a lot of great information on here. The testimonials, many of the testimonials we were talking about are right here. But if you click on the Contact Us page, if you want to get a hold of Joyce, all her information is right here.
If you go to the under the column where it says more, it'll show you contact. And when you click on that, not only do you get my information, but there's a contact form. So you can fill it out, put your phone, email, and I'll get back to you.
Okay, thank you for that. So then the other thing is I wanted to show them the YouTube channel.
Sure.
So, and Joyce, if you guys do fill out that form, Joyce can send you an email that will show you the different things that you might want to look at. But one of them is this Trifecta Light technology. It's actually called Trifecta Light Official. And so when we scroll down, you see where it says testimonials and more. Here's Jerusha talking about her having had a stroke. Here's Jane Hurley talking about, and she's a practitioner, just about a variety of different things in her practice. This is Brian Bristol. He was the one that was talking about that lady that was pretty depressed. This is Lauren Rock. If you get a chance to watch this, she's had phenomenal results. I just wanted to point out actually Arnett's video, and it's right over here, all the heart attacks and stuff like that. So if you get a chance to go to these videos, I think you'll be really pleasantly surprised to know that most people will have great results just checking out red light therapy. So first of all, talk to Joyce about red light therapy. And second of all, get in the bed. Now, the next thing I wanted to talk about was, I suppose we could talk about my book. All profits go to charity, but the book is $22, and it is it's 260 pages, give or take, and it's chock full of great information. I have people who, the phrase they use is, "I've been devouring your book." I didn't even devour the book. I only wrote it, but it really is well written. And I can say that because I'm not the greatest writer, but I wrote a really great bunch of information. And then I hired a team that really perfected it. So I have the raw stuff here. I did 90-something%, but they cleaned it up, and it's almost poetic, some of the writing in here. So I just wanted to point out, if you look, see this little section here where it says look inside, if you click on that, it'll give you an opportunity to see the first 18 pages if you'd want to see that. And then, so we talked about the YouTube channel. We talked about Amazon. I want to talk to one more thing, and that's Google Scholar. If you have questions about what could this do, and is there any side effects, and I already told you there are none, essentially. But if you put in the word photobiomudulation, that's what this is all about. Photobiomudulation, photo for light, bio for tissue, modulation that does something. And if you look here, I don't know if you can see it, it says over 21,000 different articles and research papers and double-blind studies and hospital studies and medical studies. It's fantastic. And then you might have a question, and I get these questions all the time, like about lupus or about any number of different things. You just put in the word, for example, lupus. But I have right now, we're working with trying to work with the Veterans Administration, as Joyce will tell you. And so post-traumatic syndrome, there's a whole section on that. And it's over 2,000 results about PTSD or post-traumatic syndrome, that kind of stuff. So yeah, we were just talking about post-traumatic stress syndrome. And Joyce, you've been working with someone from the Veterans Administration who's also a veteran, and he's had some significant issues. So what exactly was he experiencing?
I've only seen him 3 times so far, but he said from the very beginning, he just feels very relaxed. Well, I saw him the other day for his third session, and he said, I'm just, a lot of my anxiety is going. I'm feeling more relaxed, and I'm also getting deep sleep. And when people don't get a good night's sleep, that has a very big effect on their health. So this has been very exciting for me, Dr.
Yeah.
Rothschild.
Yeah, no, and and you and I are both givers. I don't know how else to say it. So it gives me a big thrill when someone feels like we've helped them. But imagine what we could do if we can get into the Veterans Administration. There's so many, and we have a center right here, a federal facility right here in West Los Angeles where I am. And outside of around all around there have been all the homeless people. Now, this is not about not doing other things. It's not, we're not telling people not to follow what their medical doctors tell them to do. We're just saying add it to your protocol.
I'm so glad that I was able to have you as my guest today, and I'm delighted to be a part of this team and working with you and Trifecta Light. Um, if you want to contact me, go to trifectalightealth.com, and you'll see at the top there's the word more at the upper right. You click that, and a contact form comes down, and it's got my information on the right. And on the left, you can type in whatever questions you have, or if you just want me to contact you to talk with you, and I will be happy to do that. Phone number is 310-980-7665. My email address, joyceholistic.health@gmail.com. trifectalightehealth.com. I just want to thank you so much, Dr. Rothschild, for taking the time to be on this Zoom call with me today and to get this vital message out to as many people as possible. I think we're going to save a whole lot of lives. We already have.
Joyce, thank you so much for giving me this opportunity to talk to these people. Yeah, if you don't get in the bed, I think you're making a big mistake. So talk to Joyce, and if you're not local, she can find a location nearest to you. And if you are a practitioner and you really want to have the state-of-the-art equipment, you need to have red light therapy in your life. And Joyce can talk to you about how to get that in your life. At any rate, thanks a lot, Joyce, and thanks everybody else, and take care.
And thank you so much for being here with us, Dr. Rothschild.
All right, my pleasure. Take care. Thank you.
Bye-bye.